is Taylor Sullivan. During this video, I will be doing a medication administration checkoff. So I can start by showing my outfit. I've got my uniform on, I have my badge, I can do a 360. I have a trash can right there, and then I have all my equipment that I need. Okay, so before we start, I'm just going to state that I am in a no interruption zone. I'm not to answer any calls, not to talk to any colleagues. My medication administration room door should be shut at all times. And so yeah, so I have my order form here and my MAR sheet. Okay, so now what I'm just going to be doing is comparing my sheet to make sure that everything is the same. So I'm going to start off with my patient. I have Jaguar J. Jones. My medication that I'm going to be administering is heparin. So I have heparin on my order sheet, and I have heparin on my MAR. 5,000 units for my dose. Route is subcutaneously, and that is on both of these. Time is every 12 hours. Okay, so for the indication, heparin is used as an anticoagulant to help prevent blood clots from forming. And then I have all formats of a legal prescription here for documentation. So I can take my order form and set that aside and just use my MAR for the rest of the checkoff. Okay, so I am now going to perform hand hygiene, and I'm going to first begin my first check for accuracy. So for patient, I have Jaguar J. Jones. Drug or medication, I have heparin. I have heparin right here. I've got 5,000 units for the dose. This says 10,000 units per milliliter. Route is subcutaneously. So I have a tuberculin syringe for my route. It's got the needle already in there. Time is every 12 hours. Mr. Jones has not had his heparin yet, so he is in time to get this injection. Indication, again, heparin is used as an anticoagulant to help stop formation of blood from clotting. I think I said that right. And then for documentation, I have all legal forms of a prescription here, so we can get started with our drug. So I've got heparin, 5,000 units, 10,000 units per milliliter. This is in date. The expiration date is 12/5/25, so we're good to use this. It is subcutaneously, so I'm going to use a tuberculin syringe. So before I draw up any medication, I'm just going to set this aside. I'm going to clean the vial. So I'm going to start from the center and then work my way to the edge or the rims, and then I'm just going to set that down. I'm going to take my tuberculin syringe. I'm going to set this aside as well, just to show that it's tuberculin. Okay, so heparin is 10,000 units per milliliter. I have an order for 5,000 units, so 10,000, 5,000. That is half. So it is per milliliter, So that'd be half a milliliter. So it'd be 0.5 milliliters of heparin that I would be drawing up. So I'm just going to draw up air first to 0.5. Okay, so now I'm going to take off my alcohol pad, take off the cap, just set that down, and then I'm just going to pop it in and then push the air through. So my dose is 0.5. Well, my dose is 5,000, but I'm drawing up 0.5. And I don't see any air bubbles. Okay. So now I'm just going to take my cap, hand behind my back, just to show that it's 0.5. Okay. So before I would give this injection, I would double check my calculations and the dose with another nurse. Before I move on, I think I did all of the checks, the 7 rights. Did my tuberculin, got that. Okay, so now I am ready to, I am done with my first check of accuracy. I am now going to start my second check. So I've got Jaguar J. Jones as my patient. I've got heparin. Heparin is here, and I drew up heparin in the syringe. I've got 5,000 units as my dose, 10,000 on the vial per milliliter. So that calculated, it would be 0.5 milliliters of heparin. We've got subcutaneously. I've got my tuberculin syringe. Time is every 12 hours, and he is ready for that. Indication: Mr. Jones is getting heparin. It is an anticoagulant, and it helps with the it helps the blood not have any clots, or not form any clots. And then documentation. We have all legal forms of a prescription here. So now I'm going to make a label for the tuberculin, or for the syringe. So I've got my Sharpie here. So I'm going to do the name. So, Jaguar J. Jones. I've got the dose, or the drug is heparin. $10,000 units. And then my dose is 5,000 units. And in parentheses, that's 0.5 milliliters. Okay. So I've got my patient's name, the medication that he is getting, and the dose. So now I'm just going to set that on the syringe, and that completes my second check for accuracy. So now I am able to go to my patient's room. So I would bring my MAR sheet, my syringe, and my medication vial. Just to set some of this stuff to the side. Okay. got my sharps container here. So I would knock on the door. Hello, my name is Taylor. I'll be your student nurse today here at South. Perform hand hygiene. I'm going to identify my patient. So, on here, see I have Jaguar J. Jones. Jaguar J. Jones. MAR number is MR number is 417-6352. 417-6352. So I have identified my patient. So now I'm just going to be assessing for allergies. So I see you are allergic to penicillin, and that is also on your wristband. Is there any other allergies that we are not aware of? No, okay. So now I'm going to lift the patient's bed to a working height, and I would lower the side rail, and then I'm going to don my goggles and my gloves. And then perform my third check of accuracy. So I've got my patient, Jaguar J. Jones. I've got my heparin here as my drug or my medication. I've got 5,000 units as my dose. I've got 5,000 units. Heparin's on there, and it is 10,000 units per milliliter. So with that converted, it is 0.5 milliliters in the tuberculin syringe. It is subcutaneously. I've got my tuberculin syringe every 12 hours. He is in time to get this medication. Indication: Mr. Jones is getting heparin because it is a anticoagulant, and this will help him not form any blood clots. Okay, and then my documentation. I have all forms of a legal prescription here. So now, before I would inject my patient, I would pre-assess him. And since this is subcutaneous, since this is a subcutaneous injection, I am going to be doing it in the abdomen. But first I would assess the skin for any bruising, edema, or inflammation, and I do not see any. So now I am just going to clean the injection site, and then lay my alcohol swab right there for an indicator of where I'm going to be poking. So now I can take off my cap, place it in the sharps bin, and this is sub-Q, so I'm going to be pinching the skin. Okay, Mr. Jones, big poke. Okay, so now I can take the needle out, and then I would place the alcohol swab on top of the injection site, throw this in the sharps bin. Okay, so I would raise the side rail and then lower the patient's bed and place him comfortably, and I take my gloves off, and then I would assess the patient for any allergic reaction to the heparin, and then I see he's good to go, so I am going to go out of the room and chart everything in the, or document everything in the MAR, so I document basically everything I did today, and then I'll document the patient's reaction to the medication, and then I would go back into the room and reassess the patient, reaction as well to the medication as indicated. I'm trying to make sure I didn't forget anything. Made sure everything was cleaned, put everything in there, did the label. I did 3 accuracies. Got that. The only thing I can think of that I did wrong was not point my hands down towards the trash can when I took my gloves off. But other than that, that completes my medication administration checkoff. Thank you.